Good morning, class. My name is Valeria, and my topic is the shortages in healthcare staffing during COVID-19 pandemic. Now, as many of you know, back in 2020, January 2020, we got hit with this terrible virus, and the healthcare industry hasn't been the same ever since. I have been part of it. I'm currently a certified nursing assistant, and I was working when the pandemic started, all the way up to now. And I have been able to see how we have transitioned from the worst part of the pandemic to now transitioning to an endemic, and just seeing firsthand everything that's going on in the hospitals or the facilities that I have been working at. It has been quite an experience. So I wanted to share some of the points and some of the things that I've seen and that I have been able to experience throughout working during this pandemic. So I believe the first thing is that definitely hospitals need to have the right staffing in order to be able to provide the best care for their patients. So they have, it's been said that we have been facing burnout and people don't want to work. Nurses are quitting. Nursing assistants are burned out. And so, from my experience, when I started working at a facility, when the pandemic started, we have shortages. Of masks, PPE, which is the protective gear that we were supposed to wear. We were wearing N95 masks for over 3 weeks, and they were just saying, oh, just Lysol it and it will be okay. When you're supposed to change your mask every time you go into a different patient's room. And so when it comes to staffing too, they were giving us overload of patients, and this is what's been happening not only where I currently work, or where I used to work, but everywhere throughout the US. So before the pandemic, we were healthcare staffing was twice the risk of being burnout compared to the general population, according to some research. And 40% of those people that were surveyed that time before pandemic reported that they had depression, suicidal ideas, anxiety, and all of that. Well, that has almost tripled since the pandemic started. And personally, I have felt it. I have felt burning out. I have felt that I can't take it anymore because it's a lot going on. You have your other patients, and you have COVID patients, and you have all these things going on. And specifically where I work, we work with trach and ventilators. So it's like twice the work. You have to keep on check that your patients are not, the oxygen is not desatting and things like that. And it's just a lot of work, and the load of patients that they give you is a lot. And so, according to these research, the numbers have tripled. So now, if people had suicidal tendencies or depression in the healthcare industry before due to burnout and overload, now it's even 3 times worse. So the problem is that they don't have enough staff. There's not enough resources, and there's definitely they keep on taking patients. They keep on admitting patients. They keep on taking more patients, and then what they do is just that they give you more patients, and you cannot take good care of them if you're supposed to have only 4 patients and they give you 7. It's very it's not going to be possible to give the best care that you can. And so my points to consider here is the importance of taking care of the in-house staff. And when I say in-house staff, I mean the people that are working at the hospital or at the facility that are from, in this case, from LA County or California. So in order to prevent burnouts and walkouts, so I believe that they have to have a balance, and they have to stop admitting so many patients, so we can take care of the ones that we have, and also so we don't have a burnout. And referring to in-house patients, basically what's been happening and the solution that the hospitals have found is that they can have travel nurses come from other states to here, and mysteriously these travel nurses or certified nursing assistants get paid 3 times more than the regular in-house nurse or nursing assistant or respiratory therapist. So I believe it's kind of unfair, because instead of like giving a raise on the salary to the nurses or the healthcare staff, they are bringing people from another state that know nothing about these patients, that have never worked here, and so it makes it a little hard to work, because these people are here basically just for 3 to 4 weeks, or depending on their contract, and some of them are making outrageous amount of money. We have heard that some travel nurses at the place where I work are making $6,000, $7,000 a week. And so my question is, why can't they just like give a bonus or give a better pay to these people, the people that are here, your hard workers, instead of paying a travel nurse? It doesn't really make any sense, because when you ask for a raise, the hospital says they don't have a budget. So that's one of the things. And then I think that a solution to the shortages and everything has to be focused on taking care of what we have. I've seen a lot of nurses walk out in the middle of their shifts and never come back. And I think that has to do a lot with the fact that we don't feel supported. And so I think a good solution would be providing mental health resources for burnout and emotional stress. I think they have to focus more on providing the mental health care that we need. I have felt sometimes that I cannot go on, I cannot take care of my patients, I feel tired all the time. And then on top of that, if you get sick, like I got COVID, and I did not feel supported by my hospital, because they wanted me to go back to work right away according to the new CDC guidelines, and I didn't even feel good at the time. So I feel that it all comes down to how management takes care of their employees. And I think that in this case specifically, nurses, doctors, respiratory care therapists, technicians, certified nursing assistants, people from the cleaning crew, everyone has been doing their best, to be able to overcome this pandemic. And I feel that as employees, we're not appreciated sometimes as we should be. And that creates emotional stress, and that creates burnout, because instead of getting a raise, we're getting a raise on patients, like we're getting more patients. And it's not only about the money too, but I think that they should focus more on providing mental health resources. So when we feel overwhelmed, or whatever the situation might be, among that and also the things that we have going on at home, we can feel supported by the place where we work, by the hospital, by the facility where we're servicing at. So I think that those are my points. I wish I could have more time to talk about this, because it's such an extensive topic, and there's so much more things that we could do, or I think that management could do to prevent walkouts and burnouts. And like I said, it all goes down to having the right staffing, not oversaturating hospitals and just trying to provide the best quality care, because our patients need it, they deserve it, and it all goes down to that. Thank you so much.